Diabetes affects 347 million people worldwide. It will be the 7th leading cause of death by 2030. Diabetes-related amputations occur every 20 seconds. In Guyana, diabetes represents a dire public health problem. Almost half the country's population suffers from the disease. Diabetes-related amputations are alarmingly high in Guyana, a country that has struggled with the lack of accessible, effective, and affordable public health care programs. The Banting and Best Diabetes Center is working with the Guyanese government and frontline healthcare providers to reverse this disturbing trend. The goal of the Diabetes and Footcare program is to share Canadian innovation and expertise, translate this knowledge into practice, and enable local healthcare clinicians to care for patients with skill and confidence.
A great deal of progress has obviously been made in that regard in terms of trying to get this developing from a project to a program of the Guyana Department of Health, which I think is really important for its sustainability long term.
The Guyanese program is succeeding where others have failed, in part because of our focus on multifaceted interventions. This includes established training programs, mentorship, and coaching of key local opinion leaders, and effective government engagement at every level. We're improving standards of diabetes care using methods that are simple, easy, and affordable.
This trip was very intense in terms of delivering workshops. And that was when I began to get hope that this project really was going to roll a long way. And then when we started seeing the Footcare being delivered, that was very exciting too, and seeing what people were doing with diabetes medications and managing hypertension, and again doing some mentoring and some site visits.
The success of the program has been extraordinary. Local hospitals have seen a 50% reduction in diabetes-related amputations. The focus now is program expansion. We're looking to introduce similar programs to regions of the Caribbean and Africa. And we're bringing the knowledge we've gained back to Ontario. By providing innovative care and education abroad, we're helping to address diabetes in vulnerable populations here in Canada, First Nations, new immigrants, and people living in poverty.
I'm passionate about improving the care of people with diabetes around the world. There's this huge epidemic starting in the countries that can least afford it, low and middle income countries, and I'm passionate about doing something about that.
The Banting and Best Diabetes Center continues to creatively combine resources and expertise to impact diabetes prevention and outcomes at home and abroad.